Welcome back to Bertology. Today we dive deep into what's really going on with the NHS in 2025, the pressures, the plans, where things stand, and what may happen next. The NHS in England is at something of a crossroads right now. The government has published a 10-year health plan, aiming to reshape how healthcare is delivered over the next decade. It's a bold vision, with three major shifts: moving care from hospitals into the community, going from analog to digital, and transitioning from sickness-based treatment toward prevention. But letting ideas sound good is easy. The real question is how well the NHS can deliver under huge financial workforce and structural challenges. What are the big problems facing the NHS right now? First, demand is skyrocketing. The UK's population is aging, and with that come more chronic illnesses, more long-term care needs, and more strain on capacity. The NHS is trying to cope with higher demand for hospital care, GP dental appointments, emergency services, diagnostics, and mental health services. Second, waiting lists are enormous. Many patients are waiting for hospital or community care and treatments, sometimes for very long periods. Delays in diagnosis, especially for serious conditions like cancer, are a major concern. Third, there's a workforce crisis. Staff burnout, difficulties in hiring, retention problems, and morale are all serious issues. Many healthcare workers are stretched thin, and that affects both quality and timeliness of care. Fourth, finances are tight. The NHS must balance its budget even while demand and costs rise. The 2025-26 planning guidance requires NHS organizations not only to deal with growth in demand, but to reduce or stop spending in some areas, cut waste, improve productivity by 4%, reduce cost base by around 1%. There is also a push toward giving more financial flexibility to local systems so they can plan according to specific needs. Fifth, there's the issue of inequalities. Many people in poorer or more rural areas, or from minority backgrounds, experience worse access to care, worse outcomes, and shorter healthy life expectancy. Narrowing those gaps is a stated priority in the plan. What is the government's 10-year health plan promising to do? The plan is massive in ambition. Some of the key commitments and proposals: neighborhood health services, integrated community care, more care closer to patients' homes. This means shifting outpatient work from hospitals into community settings, expanding neighborhood teams that work across different parts of the NHS, social care, local government, and third sector organizations. Digital tech and innovation, improving digital access, unified patient records, more efficient administrative systems, AI tools, remote monitoring, predictive tools, and making the NHS app more powerful so that patients can do more from home. Prevention and public health, trying to stop illness before it happens rather than just treating it after it shows up. That includes targeting risk factors, improving health checks, maybe more investment in social care or addressing social determinants. Restructuring and governance changes, reducing bureaucracy, restructuring NHS England, possibly giving more responsibility to local integrated care boards, changing how funding flows, reducing duplication, finances, and accountability, planning for constrained budgets, expecting local systems to live within their means. Tough decisions are going to be required, especially around non-frontline roles or what might be seen as overheads. Where are the challenges in making this vision real? Many challenges stand between promise and reality, funding growth versus cost pressures. Even though there is a plan for real terms budget increases over coming years, these are modest relative to what many believe is needed when you factor in inflation, higher costs, workforce pay pressures, and rising demand. Workforce shortages and retention, training enough doctors, nurses, allied health professionals, and retaining them is hard. Burnout is real. If people leave or drop hours, that puts more pressure on those who stay. Also, recruiting internationally has been politically contentious. Infrastructure and digital readiness, rolling out unified patient record systems, making sure remote digital services work everywhere, including rural and poor areas where digital access may be weaker. Ensuring data security and usability is another hurdle, balancing priorities and managing expectations. Because the NHS is trying to do so much: reduce waits, improve cancer outcomes, shift care, invest in prevention, narrow inequalities. Not everything can be done at once. The trade-offs will mean some things happen later or less ambitiously than people hope. At local variation, one size doesn't fit all. Communities differ in population health and social determinants, in geography and existing capacity. Local leaders need resources, support, and flexibility to adapt. The plan tries to give more autonomy. That's good, but implementing appropriately is complex. Time lag. Some of the changes, especially prevention, cultural shifts, workforce training, take time. We may see frustration if progress is slow, or outcomes don't improve as quickly as people expect. Some critics already warn that reforms may be delayed or under-delivered in early years. What are signs of progress, and what might people notice first? In the short to medium term, some of these will be felt more than others. Patients may notice more digital tools, more options for remote or community-based care, more ability to manage appointments online, more diagnostic centers in or near communities. Some reductions in bureaucracy as NHS, England and ICBs are asked to streamline operations, reduce non-frontline spending so more money goes to patient care and efforts to reduce waiting lists and improve outcomes for cancer. Diagnosis, treatment are high priority. Gradual improvement in prevention and public health messaging or programs, but those will take time to show up in the data. What could go wrong or slow things down? If funding doesn't keep pace with rising costs or political priorities shift, many reforms could be undercut. Workforce problems could worsen. Staff leaving, low morale, inability to fill vacancies, or insufficient training capacity could slow transformation. Digital and infrastructure implementation could face delays, compatibility or interoperability problems, or fail to serve all populations equitably. Local systems may struggle with the autonomy that comes with responsibility if they don't receive enough support or clarity. Public expectations may outrun what's feasible in early years, leading to dissatisfaction. In short, the NHS in 2025 is trying to respond to enormous pressures and doing so with what looks like a serious strategy. The next few years will be critical in seeing whether the promised shifts, hospital to community, analog to digital, sickness to prevention can really be delivered, and whether the NHS can regain public trust and improve outcomes while balancing budgets and workforce morale. The path ahead is full of challenges, but there are also reasons for cautious optimism if the various pieces align. If you want, I can pull together a projected timeline of how these reforms might roll out year by year, or look at specific case studies of areas where the changes are already making a difference.